With the recent measles outbreak that's occurring nationwide, many New Mexicans may be wondering if they are at risk for contracting the disease too, or maybe their kids. And above all, what should they do? So here to help us better understand what's going on and what we should do is Dr. Dwayne Ross with Blue Cross Blue Shield of New Mexico, one of the medical directors there.
Correct.
Glad you're with us, doctor.
Thanks for
joining us.
Thanks
I don't know
for
if there's a hotter topic right now in the news.
Possibly
than
not.
the measles and vaccines. So the question is, do we need to worry here in New Mexico? What's on tap as far as the latest with the measles outbreak, and has it reached our state?
So the information from the CDC, they update their information every Monday, and as of this past Monday, there have not been any cases in New Mexico yet. But of the 5 states that touch our borders, 4 of them have had cases. So we're surrounded.
Does that speak to the level of vaccinations in the state, do you think? Or is it just by chance that it hasn't entered New Mexico yet?
Well, the country in general hasn't really reached the level that we want for what's called herd immunity, 95% immunization. Some areas reach that, many don't. New Mexico runs about 89%, so we're below the national average, we're below the herd level. But I think for right now, it's just been a matter of luck for us.
Do parents need to be concerned then, do you think? Is this headed toward our state at some point?
I think there's no reason to think it won't come to New Mexico. If it doesn't, again, it'll just be a matter of luck. People should be concerned, but there are simple things to do, which is simply just to get vaccinated.
And that's a good question. There are going to be people that are on both sides of this issue.
Correct.
And certainly New Mexico allows people to have exemptions for medical or religious reasons, correct? And can get that on file. But there are school districts, including APS right now, Santa Fe as well, that are knuckling down on that and saying, show us proof that you have vaccines.
Right.
And are we going to continue to see a movement in that direction? Or will there always be the ability to have an exemption, do you think, in our state?
Well, that's a good question. I think it depends on how severe this gets and how many outbreaks we start to see. Last year we had a high of 644 cases in the United States, and that was the highest we've had since we considered eliminated in 2000. The exemptions vary from state to state. West Virginia and Mississippi only allow medical exemptions, for instance, and they hardly have any cases. It depends on how severe it gets and how concerned people become.
What is the level? You mentioned the hope is 95%. What percentage did you say was true in New Mexico of vaccinations?
89% as of 2013.
That seems high. Is that about the right level as to what you want, at least at this point?
No, we want 95% or better to get what's called herd immunity. There are people who can't get immunized, either because they have an immune system problem, they have leukemia. Children below the age of 12 months are too young to get it. And so they need protection by having those around them vaccinated. And that's the herd immunity. If we don't have a certain level, they're not protected.
Are we going to be hearing more about this? I guess to ask a doctor who is kind of involved in this almost all the time, did you expect to see this rise to such a level with an outbreak like this? And where do you expect to see it go in the future in New Mexico, across the country, a vaccine discussion, or even just a spread of the virus?
I think back before we had the vaccine, when there were so many cases and so many complications, people were concerned, and we developed this and we drove it down. I think it's going to take a reminder, I think, from people seeing illness to understand that this is important and that we need to do this nationally.
So you're an advocate then of getting a vaccine?
Absolutely.
Yeah. And where can people go to do that? You have information on learning more about vaccinations in the state?
I think there's 2 main sources to get information. The CDC is always a great source, and locally nmhealth.org, which is the Department of Health, the website.
Okay. We're going to, of course, have a link to that on our website, KRQE.com, under the KRQE links if people are interested in doing that. But there is, of course, more debate and discussion, I can imagine, on both sides of this issue in the coming weeks. Yeah. You expect to see that at Blue Cross Blue Shield?
I think there will always be discussion. I think it's important also there's been a lot of animosity between the 2 sides, and I think people need to remember that the people who are concerned about vaccines are concerned for the safety of their kids, and they are not to be made to look like villains. I think we need to address their concerns and get information to them and make them feel comfortable with this.
Okay. Doctor, we appreciate it. Thanks so much for joining us this
morning.
And of course, again, KRQE.com, KRQE links. Appreciate it. We'll be right back.